All right, you've come in for your appointments. You can tell that we're doing things because many, if not pretty much most all of you at the end of the day, are going to walk out the door saying, I think I'm feeling better. I came to my therapy sessions, or maybe at home you say, I do the therapy exercise and I can tell I improved. My pain and my symptoms go down. I can tell I'm moving more. And you'll also find by being here amongst other patients, maybe overhearing things, you will find some of the easier patients will take that progression and in a linear fashion, they'll say, I'm better each time I come in until eventually we get to their 100% better and then they're discharged from therapy. But there is going to be a handful of you, actually moderately decent amount, that aren't going to follow that linear pattern. You may say, hey, there's some days I feel like even better than expected, but then there's other days where I'm like, this is really kind of crummy. And I'm kind of curious as to why this patient over here seems to be getting better, but I can feel great now, but later my pain wants to come back again. Some of you, that later is really quick. It might be 20 minutes after you've walked out the door. Some of you, it's tomorrow morning. Some of you, it's 2 days later. Wherever it is, you're saying, I want to win the day. I want this thing to be gone, and I want it to stay there. So why is it, again, that things on some people seem to be progressing easy, and you just take it one session at a time, and you might be one who says, I'm struggling with my problems, want to come back later. Well, in all my years of being a therapist, I've really only come up with 4 potential solutions or answers to why that is the case. First thing we're thinking about is how deep is your injury? So the person who injures themselves by having a bad monitor position here at their desk, as contrasted to the person who got hit 100 miles an hour by a Mack truck and blew their body up. Obviously, the depth of that injury, requires deeper treatments for the second person compared to the first. So those people may find, even though while we've started to bring that body back into a better place on those sessions, just how deep those muscles and bones are out of whack, that makes it obviously harder to get it all out at one moment in time. So the secret to those people, if the injury is deeper, they often need to work deeper. So the person who can do like a few exercises for a few seconds, say, oh, that was great. You might be the ones got to work a little harder. You got to push a little more. You got to hold it a little longer. You got to give it a little dumbbell. You got to do some of our deeper tricks you'll learn from us. Whatever it is, it's just figuring out that way to say, I just need to go a little heavier into some of those injuries if I'm going to win the day. So that's number one, is how deep is my problem. The second has to do with how long has my problem been present. So some people have had a perfect body prior to 2 weeks ago starting therapy where they had an injury. Those people may find we put it back in and it sticks. But you'll also learn there's nerve endings called our proprioceptors that try to keep a status quo. So let's say my body's been tightened out of whack on some of these spots for years, going on decades, and even some of you even longer than that. So you may say, I find I'm pulling it back here, but then neurologically, like programming, the body says it naturally wants to revert back to its natural status of where you've been. That's why the people who have normally healthy bodies do the weekend warrior thing on a Sunday, hurt their body, but by Monday they're already okay. It's reverting back to its normal. But if your normal is crooked, out of alignment, you've had these things for a while, you're going to find it's going to fight you to some extent. Now, if you've ever been asked or heard the question, how long does it take to change a habit in literature? Maybe some of you spit out 21 days. Maybe you've heard that before. Some other studies might suggest maybe a couple months. Whatever it is, that ties to that neurological fight we're talking about here with those nerve endings. So the secret to the people who find I've just had it for a while is consistency of frequency of treatment. So if I find I did this exercise, I did it for 10 minutes, I felt better for 6 hours, then I wanted to come back again. Well, that person may need to do that exercise every 5 hours instead to make sure it doesn't come back again. Or maybe I try for 15 minutes to see if that gives me longer or something like that. Again, the secret there is figuring out that frequency, making sure my body in a 24-hour day has more time in that good place. So maybe it's not just the amount of minutes a day you do stuff, it's how often do I treat myself. So that's number 2, is again, consistently giving my body a good position more of its day. You start to have a good Tuesday, you'll find again Wednesday is easier than Tuesday. You start to have 3 good days in a row, you'll find it's been a good week. Figuring out that pattern. So that's number 2, how long have you had the problem? So the third reason why pain can come back on people has to do with what I call postural and environmental things that are factoring into your pain too. So let's say, for example, I did my favorite exercises. I could tell my body was in a better place. And I do that exercise routine 30 minutes a day. But let's say I go back to work and I've got this crappy chair at my computer desk that I've had that every time I sit in and it hits me wrong and my body gets screwed up just from this crappy chair. Well, and I'm in there for 8 hours a day. So what's going to win, the 30 minutes of treatment exercises or the 8-hour crappy chair? Well, so that in that case, we got to make sure we address the postural environmental things. Well, there is a session called Life Skills Day. That's going to be one of the more important sessions you have, where we teach you how to analyze and test out, unique to you, what those things are that you need to make sure we address. But if you think about your 24-hour day, if there's a certain task or time of day or a place where you're hanging out that you notice that your symptoms are more likely to return, well, that could be the reason. I need to change something about that posture or that environment to make sure I'm addressing that. So that's your number 3. The last one's a little more fancy. This is what I call the missing piece. So let's say I've got a neck problem and I'm noticing that when I work this arm and neck kind of torso stuff, that I can tell it's getting better, but it wants to come back and I'm not figuring out why. But let's say I had this old tight hip thing from high school that has had no pain at all for all these years, but it's tight and out of alignment and stuff like that. Maybe your therapist brought it up in testing. And that could be the thing like my shirt here that's keeping that tension there, keeping that stuff out of alignment. So you're doing something to address the area of symptom, but there's another part of you that actually is making sure that that pain keeps coming back again. So that's why we want to make sure in your time in therapy, we're looking at your whole body. We're making sure all the different pieces of your biomechanics, as we call them, are being addressed so that, again, you can win the day, so you're getting the structure that can make it last. So once again, quick review. If you found that, again, your pain keeps coming back, you have to ask, is my problem just deeper than some? In which case, do I need to push myself into deeper treatment? Is my problem just been there for a longer period of time, not just in pain, but tightness or alignment, and it wants to fight just because it's, again, programmed to be going back to crooked? Well, if that's the case, maybe you're asking yourself, is there a frequency change I need to do with my home routine to make sure I keep making it better until it gets easier as time goes along? Is it a postural environmental thing? Is that one time of day or task that I need to change something I'm doing with that? Stand up more, sit down more, change my monitor position or whatever it is. Again, we address that stuff with Life Skills Day. Or is it, again, that missing piece that maybe I've just been doing a lot of these arm exercises, maybe I should be doing some lower body stuff or vice versa to make sure I'm addressing all the pieces in the puzzle. Maybe that is the case. And once again, these are conversations you can have with your therapist too. So if you address all those things, if you can win the moment, you can win the day. If you can win the day, you can win the week. If you can win the week, we can win the month. How do we make sure it lasts? Make sure we're addressing all 4 pieces in those puzzle, and hopefully that takes care of it. So God bless. Hopefully that answers your question.